Thanks for joining. It's 2:06, so we'll get started, not to take up too much time. And if folks have other things going on, we'll try to finish by 3 o'clock. This is another session that the ICGC Adult Islamic Education Council Committee are bringing to you. Yesterday you heard where do we go from here regarding the infectious disease. Today we have Dr. Saba Chughtai, and she's going to be talking about coping with stress and anxiety. So Dr. Saba Chughtai did her residency in psychiatry from the University of Wisconsin. She is a board-certified psychiatrist and owns a private psychiatry practice in Mason. She has been practicing for over 20 years, and she's passionate about philanthropy and giving back to her community here in America and in Pakistan. Dr. Chughtai is the founding member for the nonprofit organization Pakistani American Ladies for Social Welfare, as well as an active member of several interfaith groups. She is a recipient of the Woman of Excellence Award 2012 and the YWCA Career Woman of Achievement Award 2013. These sessions are being recorded, and they will be uploaded to the ICGC YouTube channel. If you have any questions, please submit them through the Zoom chat that we have enabled as well. With that, I'm going to turn it over to Dr. Chughtai.
Thank you, Seema. Assalamu alaikum, everybody. Thank you for giving me this opportunity to be of some service during this, this crisis that we're all experiencing. Can everybody hear me? Yeah, I guess they can. So, you know, we're all living with a new normal, as we would call it, because of this COVID-19 pandemic. And a lot of people are feeling tremendous stress, they're feeling anxious, they're feeling depressed, and it's taking a toll on us. So if we look at what's going on right now, I would actually start by saying that even under normal circumstances, you know, anxiety disorders happen to be the most common psychiatric condition. So about 40 million Americans have anxiety. And another way of looking at it is if in a 12-month period, at least 19% of Americans will have some kind of anxiety disorder. So I've tried to look at some of these anxiety disorders by themselves, and then I'm going to put them in the context of our current situation. So let's look at some of those things. Generalized anxiety disorder, it's about 3.1% in the adult American population. OCD is 1%. Panic disorder and agoraphobia is 2.7%, up to 3%. So as a psychiatrist, I want to remind people that all psychiatric conditions can worsen during stressful times, and people can have a relapse. So if you have a psychiatric diagnosis, please be very mindful and take extra care of yourself. But what's happening right now, it's not just people with an existing psychiatric disorder who are struggling. A very large portion of the general population is also experiencing a lot of anxiety. So let's put these in the context. Seema, next slide. So could you go back? Yes. So let's look at generalized anxiety disorder. What is generalized anxiety disorder? It's a condition where people experience excessive, persistent, exaggerated worry about daily routines. They usually will come and say, I worry about everything and anything. So we can imagine right now, people who have generalized anxiety disorder must be under tremendous stress. But in our current situation, people who normally don't get anxious are feeling very anxious. They're feeling the impact of this pandemic. It's affecting their life. And they are presenting with symptoms very similar to generalized anxiety disorder. So what happens when we are anxious? When we are anxious, we are constantly ruminating about negative outcomes, and we are imagining worst case scenarios. So, and we need to remember that anxiety is not just a psychological or an emotional phenomenon. It's actually a physiological phenomenon. It takes a toll on our body, on our physical health also. And it's disabling, not just mentally, but physically too. So next slide. Seema. Okay, so how do we know that we're experiencing anxiety? Let's look at some of the things. Constant worry about everything and anything. And a lot of people are experiencing it right now. Problems with focus and concentration, irritability, headaches, gastrointestinal disturbances, sleep disturbance, particularly insomnia, palpitation, shortness of breath, fatigue. A lot of us can experience these, some or all of these symptoms at certain points in our life. But if these symptoms become disabling, they start impairing our everyday life, they start affecting our relationships, then we need to be concerned about that. Right now, people are experiencing a lot of that, and they're genuinely worried. They are worried about, are they going to get a serious illness? They're worried about what if they die? They're worried what if someone they love, a close family member, becomes seriously ill? They're worried about their work. What if their company collapses and they don't have work? They have financial concerns. So it's very important that we treat these conditions and we pay attention to them. Next slide, please. So we also need to remember that it's not just generalized anxiety disorder that's getting aggravated among people with existing conditions, but it's similar symptoms are showing in the general population also. There are some other conditions that we have seen a spike in them. And of course, one of them is obsessive compulsive disorder. So 1% of the population has obsessive compulsive disorder. So let's see what is OCD. OCD is a condition in which we have persistent, intrusive thoughts, which are unpleasant. These are not pleasant thoughts. And then we do some kind of an action, which we call compulsion, to get rid of that thought. So a very common form of OCD is fear of contamination, germs, and getting a serious disease. So you can see right now, if someone has OCD, the conditions that we are experiencing right now, that's a perfect storm for that person. But again, as I said earlier, we are seeing OCD-like symptoms in people who've never had OCD before, especially when it comes to contamination and fear of germs and getting a disease. But I want to be careful here. I don't want anybody to misunderstand me. We do want you to wash your hands. We want you to follow all the guidelines set forward by the CDC. And we want you to wash your hands every time you come home from work, come home from doing groceries. If you've touched any surface that might be contaminated, you need to stick to those guidelines. But the point I'm trying to make here is there are people who are following all these guidelines. And so, for example, in spite of washing their hands carefully for 20 seconds, just as recommended after coming home from work or from groceries, or when they're about to eat, or if they've touched a surface, in spite of doing that, if they really still are consumed with fear and anxiety that they're going to end up infecting themselves or someone else, then we need to address this issue. In fact, I was reading an article by a dermatologist that there has been a recent increase in patients that they are seeing who have presented with their skin excoriated and especially on their hands and bleeding. So the point is, once you've taken all the precautions, it should give you some mental relief. But if that's not happening, then you are beginning to behave like someone who has OCD. Next slide. So another anxiety disorder that we are seeing a rise in is panic disorder and agoraphobia. So we'll talk about panic disorder first. 3% of the population has panic disorder anyways. And right now we are bombarded with very stressful news and stressful images. So people are experiencing an increase in panic attacks. And a panic attack can be extremely distressing. In fact, it presents with a lot of physical symptoms, and people will sometimes feel they're having a heart attack. They complain of shortness of breath, they complain of chest tightness, they feel dizzy. It's a very disabling condition, and many times people will end up in the emergency room thinking that they are having a heart attack. It's important that we recognize the symptoms of a panic attack, and we're able to walk ourselves through it and calm ourselves, because number one, it's a disabling condition. Number two, at this point, we don't want, we want to prevent people from going to the emergency room, for conditions other than that are physically very serious, like having the infection with COVID-19. Let's look at agoraphobia. That's an excessive, irrational fear of leaving the house out of fear that something bad might happen. So this is a little tricky one under today's circumstances. We need to be concerned about leaving the house these days. And it's okay to be a little worried about it, because that'll help us be more careful. The concern is for some people who actually may need to leave the house for work. For example, there are certain occupations like healthcare physicians, police officers, they need to go to work. If you are developing such symptoms that it's preventing you to go to work in spite of taking all the precautions, that's a problem. The other concern is, even when this pandemic ends, some people may have persistent fear of leaving the house. So that is something we need to be mindful of. So let's move on and look at depression. It's not just anxiety that's on the rise. People are also feeling depressed. And there are many reasons for that. One is, of course, a lot of families are experiencing loss and grief. There are many families who have had a loved one die, or who know someone who knows someone that has died. So loss and grief are actually robust predictors of depression. The other is stress and burnout. And this is actually very important regarding certain groups. One of them is healthcare professionals, physicians, nurses, paramedical staff, medics, EMTs. The reason is, we have to remember, these people are seeing a lot of trauma. They're seeing death, they're seeing grief, they're seeing a lot of loss. And it's not just that. They are at risk themselves. Every time a healthcare professional interacts with someone who may have the coronavirus infection, he is or she is at risk. So this is taking a mental toll on them. And a lot of these people at this point are physically and emotionally overwhelmed. So we need to be very mindful of that, because they are at high risk of developing depression later on. And they may also develop PTSD, which is post-traumatic stress disorder, which is a form of an anxiety disorder. Interpersonal isolation. Loneliness breeds depression. And we need to be very careful, particularly regarding the elderly, who may be, who are isolated, who are at risk of being isolated as it is. And then a lot of them may not have some of these modern electronic gadgets that we use, or may not know how to use them. So they may be very isolated. Also people who are living alone, or people who are away from their families. And we know right now, families cannot travel to meet with each other. So interpersonal isolation is also a predictor of depression. Family conflict. Just because there is a pandemic going on in the world doesn't mean there aren't other issues going on. There are many people who may have a lot of conflict with their family members. And right now, people are spending a lot of time with each other. And if you are in a very difficult relationship, this may be a difficult time for you. In fact, we have noticed an increase in domestic violence incidents because the victim doesn't have anywhere to go. So we have to be careful about that. And then, of course, financial stressors. That is a huge concern right now. Many people have lost their jobs, or companies have cut down their hours. And persistent financial hardship is also a predictor of depression. So let's move forward and look at how can we deal with this stress and anxiety.
So Dr. Chughtai, before we move on to how to cope and deal with stress and anxiety, you talked about some of the signs of depression and agoraphobia and stress, anxiety, different kinds of anxiety, but and this looks like it's for adults. Does it look any different in children? Children are also feeling anxious and stressed because they also get it from their parents. They see their parents. So what does it look like in children or even teenagers?
Well, yes, that's a very good question, actually. So for young kids, they may, they may regress. Children regress in times of crisis. For much younger kids, someone who may be toilet trained may start having accidents again. Or kids may say, I want to sleep with you, mom. Or they may become very clingy. Kids can also start acting out when they're anxious. Suddenly, a kid who's generally very well behaved becomes irritable and starts acting out. So rather than getting upset with your child, try to see what is it that's making him or her behave like that. The biggest thing with children is that they are concerned about their safety, but their biggest fear usually in younger kids is abandonment. What if something happens to our parents? And they can show symptoms of a lot of separation anxiety. They can start clinging to their parent. They may show signs of changes in appetite. They may have problems with sleep. So the biggest thing with children is you need to reassure them that we have planned ahead and we have contingency plans. God forbid if something happened, because they need to hear that. If something happens to us, you will be taken care of. That is the best way to deal with a child's anxiety.
Okay. Great. Okay. Thank you so much for that. And we'll move on. Okay.
So here's the thing. What is it that we can do with what we're experiencing? Of course, we have medication. If your symptoms are disabling, if your symptoms are really, as I mentioned earlier, impairing your life, do not hesitate in getting help. Most of these conditions are very treatable. The issue is not a lack of medication or a lack of mental health providers. The biggest issue is our own reluctance when it comes to emotional or psychiatric or mental disorders. We are the ones who tend to shy away from seeking help. Right now, there's very good medication available. Most of these medicines have minimal side effects. I'm not going to go into the detail of medication right now, but I do want to say that a lot of insurances now, under these current circumstances, are allowing telemedicine. So if you need to talk to someone, call your insurance, check your insurance plan. Most insurances are letting physicians, counselors do telemedicine. So if you need to talk to someone, other than, of course, your friends and family, if you need professional help, you do have help available. Don't hesitate from getting that help. So let's look at some of the other ways we can. So what are some of the psychosocial interventions? The first thing is know your facts, because knowledge is power. I was reading an article in New York Times by Dr. Harriet Lerner. She's the author of this book, The Dance of Fear. It's a good book. And she says anxieties escalate and fantasies flourish in the absence of information. We need to remember one thing. The biggest trigger of anxiety is uncertainty. When people are not certain or they don't know what's going on. And right now there is a lot of uncertainty. We don't know how long the pandemic is going to continue. We don't know when there is going to be a treatment available. So there is a lot that we don't know. And when people, and that is what fuels people's anxiety. Also when people, they don't have much control in their lives. And right now we are feeling somewhat out of control. When it comes to getting your facts, make sure you get it from trustworthy sources. Avoid, online sources that are deregulated, and listen to news that is depoliticized. That's important. And I would recommend go to the most trustworthy resources like CDC, World Health Organization, and your local healthcare authorities. Also, keep the disease in perspective. 80% of people who are infected with COVID-19 will have a mild to moderate course, and they will recover. However, this is not a reason to become complacent. We need to follow the guidelines for social distances. How can we handle our stress? First of all, get authentic information and then plan ahead, and don't procrastinate. In fact, when we procrastinate, that generates its own anxiety when we keep putting off things. So I would say you need to plan, even start with simple things. Do you have at least 2 weeks worth of grocery at home? People who have chronic medical conditions, do you have enough medicine? People who have psychiatric conditions, do you have enough medicine? And then plan even for more difficult things. You may have to have some difficult conversation with your spouse or your adult children. Even though we're saying 80% of people will recover, but there are people who will become very sick and who will die. Make sure your affairs are in order, and make sure you have talked things through with, it could be your spouse or an adult child or a sibling. For example, if you become seriously ill, who is going to make healthcare decisions on your behalf? When we talk about these things, we feel anxious, but really when we write these things down and we plan accordingly, it will give us some relief, and it will also give us a sense of control. Also, a lot of people who have mild or moderate symptoms will stay home. So you have to plan ahead, like do you have a room that you will designate where the sick person will be? What if both parents fall sick? Who will take care of your children? The more you write these things down and plan accordingly, the less anxious you will feel. So I wanted to show you, there is a certain site called, it's a helpful resource if you don't know where to begin when it comes with, power of attorney for healthcare or making difficult decisions. And you can see the link here. It's the conversationproject.org. I would encourage you to look at that. Let's go forward and look at some of the other things. Yes, connect. It is essential to stay in touch with family, neighbors, even pets. So use whatever means you have available: FaceTime, phone call, texting, WhatsApp. Even send a beautiful card to someone. If your parents are in another city and you're worried about them, of course, talk to them, but writing a beautiful letter would be wonderful. It's actually very important that you also connect with people who are at risk of becoming socially isolated. Like we talked before, the elderly, people who are sick and are really isolated. So you make sure that you don't leave them out. But remaining connected is very important since we cannot physically meet with people. Yes, next. So, yes, who is most vulnerable? The elderly, those who live alone, those who are living away from their families. And what about yourself? When you are feeling overburdened by anxiety, reach out to family and friends for reassurance. But I want you to remember one thing. It is important that we know who we are reaching out to, because anxiety can be very contagious. And our anxiety can be triggered by someone else's anxiety. In fact, there is a term we use, social contagion, which is a phenomenon by which emotions and feelings of one person or a group of people affect another person or a group of people. So remember, anxiety can be very contagious. When you reach out to someone for reassurance, you pick and choose the person carefully because you don't want to end up becoming more anxious. Similarly, when someone reaches out to you, make sure that whenever you give them any information, it is authentic and it has been verified. And because there is a lot of misinformation out there right now. We need to be, that is one thing we need to be very careful about. And I think that is one very big reason that's fueling our anxiety. Next slide, please.
Yeah. This is a very interesting concept, the social contagion. We talk about the virus and how contagious it is, but certainly anxiety and feeding off of others, the anxiety from somebody else. And in the previous slide, you mentioned about connecting and using WhatsApp or Facebook. We also want to be cognizant of not being trigger happy and forwarding all these messages and videos that could be true, that could be false, but still causing that overall anxiety as well, correct?
And we should use all these modes of communication more to really to connect, to reassure, to have a happy conversation. Not that we're being insensitive to what's going around us, but really, interestingly, some of us have more time right now. So use this time to connect with friends that you may not have talked in a while. Don't keep sharing just bad news. And you're right, whatever you share has to be verified, and you have to be very careful and very cognizant of the fact that you don't add to someone else's anxiety. In fact, they're saying that after this pandemic, or parallel to this pandemic, we are having an anxiety pandemic also. So, and I think social media has a lot to do with that. So let's look at, yes. The other thing is maintain a sense of normalcy. And these are some of the recommendations by the National Alliance on Mental Health. Keep up your morning rituals. Try to keep your life as normal as you can, just the way it was prior to the pandemic. Try to do that. So keep up your morning rituals, getting up, getting dressed, wearing your work attire. Create a structured schedule and a dedicated workplace. If you're working from home, maintain a consistent sleep schedule and limit how often you check your news updates. Now, here's an important thing. I think we are getting too much news round the clock and from a lot of sources, TV, Facebook, WhatsApp. It is very important that you do limit your source, how often you check your news, because that's going to make you anxious. And try to keep your life as much you can similar to what it was before the pandemic. Let's look at some of the things about sleep if we go to the next slide.
I guess one more sense of normalcy is if you continue with your prayers, that's just structured, for five times during the day, at least that could be part of your normalcy for sure.
And that'll also give you an opportunity to have some spiritual relief too when you pray. And sleep, I wanted to go back to sleep. It is important that we maintain a good sleep schedule, even for those who are not going to work. And if you're a light sleeper or if you wake up easily, number one, don't look at the news right before going to bed. That's going to keep you up. Use some kind of background noise or that if sort of white noise, if that helps you sleep. Maintaining and sleeping at least 8 to 9 hours, that itself helps you fight anxiety. Lack of sleep is a trigger for anxiety. Let's move forward. So yes, one thing I talked about was anxiety is triggered by a sense of loss of control. When we feel that we're not in control of our life or we cannot control our surroundings, That makes us very anxious. But here's the thing, we cannot control everything. We need to accept that. That itself will tell us that this is how life is. We cannot control everything. Rather than worrying about what we cannot control, focus on the things that you can control. For example, we can control our own behavior on how to reduce our risk. We can make good choices about what we eat. Foods that are healthy, foods that will promote a healthy lifestyle. Don't make sure you're not eating junk food while you're staying home. You're not taking too much caffeine later in the day. That's going to ramp up your anxiety or keep you up. Make sure you're exercising. You're spending your time doing something worthwhile. Do everything that you can do to keep yourself healthy. This is what we can control. We cannot control other people's behavior, but we have a lot of control over ourselves. Maintain social distancing, don't take unnecessary risks. So focus on the things that you can control rather than worrying about other people. We cannot control other people's behavior, so don't worry about that. Take care of yourself. All right, let's look at some of the other things we can do. Yes, practice self-care. Be kind to yourself. That is very important. Of course, we always encourage people to take care of others, but you cannot take care of someone else if you're not taking care of yourself first. So what are some of the things we can do during this time? Set a reachable goal for yourself every day, something that you've planned and you have told yourself you're going to do that. It may be something as simple as I will exercise 20 minutes every day. I will learn a new recipe, but don't just plan your day. Set some kind of a goal for your day. And also do something every day for yourself, something that you enjoy, something that you love doing. Example, reading a good book, doing artwork, listening to music. This is something that's just for yourself. Make out time for yourself. And here are two concepts, actually three, but the first two that I really want to emphasize on. One is mindfulness. It's actually a concept we use a lot in psychotherapy. It works for this situation, but a lot of other situations also. So how do we define it? The human ability to be fully present, aware of where we are, what we are doing, and not to be overly reactive to what is going around us. It's a very interesting concept. It does not mean that we should be insensitive to what's going around us. But what mindfulness means is that we should learn to, every day we should make time to take inventory of where we are right now, right in this minute. For example, I need to tell myself right now, I'm healthy. Right now, my kids are home. I should enjoy that. Right now, I can do things for others. So mindfulness allows us to stay in the moment. What happens is that when we are what we call anxious ruminations, we're constantly anxious. A lot of our anxiety is about the future. What if this happens? And because of that, we cannot focus on our present. And tied to that concept is the concept of gratitude. Gratitude is the ability to appreciate things and to be thankful. And in fact, gratitude is a very essential part of many religious philosophies, including ours. It's a beautiful concept. And so if you're mindful and you can take a few moments out of the day to remind yourself, what is my life right now? You will also develop gratitude. Let me give an example. For a lot of us, alhamdulillah, fortunately, our kids have come home. I know it's under difficult circumstances, but they're home. How often, it's been a while since all of my kids have been home. I need to savor that moment. I need to enjoy that. That's mindfulness and that's gratitude. So practice mindfulness and please practice gratitude. Gratitude is not just good for our emotional and psychological well-being. It's actually, it's very comforting for our soul. It's a spiritual thing. If, I would encourage people to look up these two things, mindfulness and gratitude, and try to practice that. The third concept that I want to talk about is reframing. It's on the next slide. Reframing is also a very, it's a concept that gives us a lot of comfort and peace. And I was reading this book, The Stress Solution, and here it says, what is reframing? Our ability to be motivated and to do purposeful things in life depends on how we choose to interpret a stressful situation. And that's a lesson for life. It's not just for this current situation. Our ability to be motivated and to do purposeful things in life depends on how we choose to interpret a stressful situation. This is a stressful situation, but there are ways of looking at it. Those of us who are healthy, those of us who have resources, that we have, we can look at it in a different way. This may be our time to reach out to those who need help, reach out to food banks, reach out to local food pantries. The point I'm trying to make is sometimes something very good can come out of something very bad, depending on how we interpret that bad situation. This could be our calling to not just start doing something good now, but to continue it. Once you realize, oh my God, helping local food banks and homeless shelters, it has been such a good thing, I want to continue doing it. So learn to reframe things. Reframing doesn't mean we are hiding away from reality or from facts. Reframing means there are other ways, there are better ways, positive ways of looking at a bad situations, rather than constantly complaining and bemoaning the fact, oh my God, I'm home, oh my God, I can't do this. There are better ways of looking at it. And actually what I say at the top, don't let fear stop us from acting with compassion and courage. And that comes with reframing. So I'm going to end here, but on the next slide, I do have some numbers and resources. This is for people who may be in acute crisis. God forbid, if you really are struggling, if you or anybody you love is having thoughts of suicide, call 911. Other resources that can be used, I have them here. We have all these resources. As I said, telemedicine is available. If someone needs to reach me, they can contact ICGC. I will be willing to help over the phone. I guess we can't do that personally right now, but I wanted to end on the three concepts, and I want people to remember that: mindfulness, gratitude, reframing. Thank you. Any questions?
That's, well, while we wait for the questions to come in, and please post them on in the chat window as well, so we can get those jotted down. I like that concept of reframing, and I guess you see a lot of that happening right now with the volunteering and what Rahma is doing, making all those hundreds of masks and giving those, distributing those throughout the local hospitals. So it avoids a feeling of being helpless, right? So really nice concept. I hadn't heard that until, talking to you about it. So that's great. And you can also teach, again, our kids,
yes,
children and teenagers and young adults, who, especially the teenagers and young adults who want to sleep the day during the day, they can do this reframing as well.
And this concept works for many other life situations also. I mean, throughout life, we will come across hardship or problems at work or a difficult coworker. And, there are different ways of looking at that situation. Sometimes you cannot change a situation, but by reframing it and finding a positive element in it, you can move forward. So it's a very good concept.
I had some, again, this is just to reiterate what you've said, Dr. Chughtai, but keeping the immunity, your own immunity strong. Just remember to do these things, breathe, you know, and slow breathing, practicing the mindfulness, getting enough sleep, eating healthy, and just, you know, simple as drinking water. We forget to do that when we're so busy, and certainly exercising you talked about. And then also, if you are fortunate enough and you still have a job, we're trying to balance both work and home when your kids are at home and daycare is closed, how you manage that, and when your spouse is also home working. So you got to balance that. And then, as you said, be kind to yourself and do what works for you as well. Okay. Shakila raised her hand. I will unmute you, Shakila.
Sorry, I was trying to send you a question, but I'm on my iPhone. Basically, what are some sleep techniques that Saba would recommend?
Okay, so one is sleep hygiene, what we call sleep hygiene, which is getting up approximately at the same time every morning and going to sleep at the same time, avoiding any caffeine after 2 or 3 p.m. or any caffeinated drinks, avoiding any exercise later in the day that tends to keep people up, using background white noise like a fan or someone, I don't know how to use Spotify, but somebody said using a repeated track on Spotify. Go to bed with a good book. Shut down your electronic devices earlier, because what happens is the light that's emitted from our iPhones and iPads, that actually simulates sunlight, and it tricks our brain into thinking that it's day. And then the brain stops making melatonin, which we need to fall asleep. These are general guidelines for all times. Now, particularly if you are feeling very anxious and none of this works for you, mindfulness, that does help with sleep. And something that's over the counter that has helped people, I recommend it a lot, is melatonin. You can get it over the counter. They say you can take it up to 6 milligrams. I always say start at a lower dose, 1 to 2 milligrams, and see that helps. Another thing which is very pertinent to us is avoid spicy food. That will actually keep you up if you take that later in the day. If in spite of that, your anxiety is still keeping you up, then maybe you need some medication, and it may be short term. If melatonin doesn't work, then you may need a prescription medication for a short while. But try all of these other things, and then let's see if that works or not.
And also try not to have late night snacks, right?
Yes. And one thing we do recommend these days is, number one, limit your source of news. And definitely don't look up news an hour or 2 hours before going to bed. That will keep you up. Not just because it's anxiety provoking, but the light itself from your device tends to keep people up. Does that help? Oh, she's muted. Anybody else?
And again, some reminders also how to be physically and mentally strong. Limit this junk food intake.
Oh, yes.
That's a big one. It does make us feel good.
Well, we also need to be careful about food these days anyways. We're not sure if the virus can spread to, when we get food, how it has been handled. So I would caution when it comes to food anyways, try to be careful when it comes to takeout or, we don't know definitely about it, but I'd be careful.
Yeah. And try to get at least 3 to 4 hours of aerobic exercise. I know, again, we can't go to the gym, and even in the neighborhoods, there are a lot of people out. So try to find a time when you can go for a nice long walk or a very quick jog get your heart rate up, essentially. We talked about, Dr. Chughtai talked about the hours of sleep. You had mentioned about, I think, 8 to 9 hours, but if you can even get 6 to 8, that's great. And try to do it, at least plan for one pleasant thing to do. If you don't plan for it, then it just doesn't happen. So you gotta, that's the first step, to at least plan it. So I thought that that's interesting. And then engage in a hobby that's different, that has nothing to do with your work or relationships. That way, when you're stressed, you can still do this, just get away from it all, you know, a nice hike, anything. So that's you know, helpful. Making, you know, just doing cross stitching, whatever you like to do. Not everybody does yoga, but stretching is also helpful.
Do something that you really love.
Yeah.
Do it for yourself.
Right.
That's important.
Yeah, that's the last one. Ask yourself, what gives you joy and what gives you meaning? Okay, I'm looking to see if there are any other questions. And looking also at the time, we have 8 minutes left. So here's some personal challenges. Dr. Chughtai talked about the what ifs, the negative what ifs, right? So, you know, take a deep breath and count to 10 and think about the positive what ifs. Turn those around, and list 5 times that make you grateful. Again, Dr. Chughtai gave some good examples there. So this is about planning and writing it down and thinking about turning the negative to the positive. And then reach out to your loved ones far and wide and tell them how much they mean to you. I personally recently did a WhatsApp call to my khala in India, in Hyderabad. She's over 80, and I don't know when the last time it was that I actually spoke with her. I get the news from my mom, but I always thought, well, you know, how do you talk to somebody who's that old, who's in a different country, who you don't know? You know, so, but she saw my face, and she was just happy to connect. And that goes back to the slide that Dr. Chughtai had about connecting.
Yes.
Wow.
And, you know, those of us who may have some time right now, we keep thinking that, oh, I'll call this person or this aunt when I have time. But this may be, you know, an opportunity for us to reach out to people that we haven't reached out to in a while. So use this as an opportunity. Again, this is a form of reframing too, that rather than constantly looking at negative aspects of what's happening right now, try to find some positive in it. And again, by that, we don't mean we're insensitive to what's going on, but what is the point in constantly complaining? And what is the point in always being negative? And I will emphasize that again. Look at things from a different perspective. It's a concept that goes a long way in helping us in dealing with many other crises in life also.
So one of the questions we have is, how do you think we can minimize the maximal overwhelming amount of information we do get online through social media? And some of it is misinformation. So how do we minimize that overwhelming amount?
But that's totally in our control. We can, sometimes I get messages on WhatsApp, and when I start reading it, I can realize right away that, you know, this doesn't make sense. I don't think this is correct. Number one, I do try to limit that. I usually get my news, I'm not going to name the channel, but just from one or two sources. And I also don't pass on news if to me it feels this this doesn't look correct. So this is entirely in our control. We were talking about control. Some things we cannot control. We cannot control what people send us. We can definitely control not to read that, but maybe we can also politely tell people that please make sure the information you're passing on to me is authentic, or it has been verified, or it comes from authentic sources. It is up to us to put a limit on that. And at night, I've been telling people, turn off your notifications. Just by decreasing our time, that helps too. We can make sure we turn the TV on at certain times. You can keep the TV on to watch other things, but we don't have to have news on all the time. We can limit our time that we're going to spend on social media. And of course, we can tell some friends, are you sure this is verified? Let's not pass news that may not be authentic or verified. So this is in our control. We can do that. Any other question?
Somebody posted that only a fool stresses over matters they cannot change. And this is from an early imam. So that's absolutely true.
I'll say that again. What was that?
Only a fool stresses over matters they cannot change.
That is very true. Focus on things that you can change and focus on things that you can control, and stop worrying what's not in your control. That's just the human condition. We cannot control everything. We want to, but we may want to have the perception.
Seem to have lost Dr. Chughtai.
Oh,
at least her audio.
I can hear you.
All right. It is at the top of the hour. We have, we got you back. Great. Yes. I was going to say we're almost at the top of the hour and we have 3 minutes left. Do you have any closing comments, Dr. Chughtai?
No, I would still emphasize on those 3 last concepts that I talked about. I want people to stay connected. I want people to use this time to do something good and really focus on the things that they can control and they can change, and not focus on what's beyond their control. Because as I said, that is just the human condition. We cannot control anything. Sometimes there is comfort in accepting our own limitations also.
Well, Jazakallah khair. Thank you so much for coming on. Please listen every night. Dr. Sheikh Hussam has great khatra as well as the duas with lots of explanations. Is absolutely wonderful. Join him on ICGC YouTube. He has taught us many duas with explanation, great detail, and we'll close with this dua. Jazakallah khair, and thank you all for attending. Assalamu alaikum.
Thank you. Assalamu alaikum. Thank you. She was very helpful.
Stop video.